Have you ever received a phone call about a lab result and felt your entire day change in that single moment? Your PSA came back elevated, and everything shifted. Your mind went somewhere dark, your heart started racing, and suddenly the word cancer was hanging over every thought you had for the rest of the day. I'm Dr. Neraya Wolfe, Urologist and Pelvic Surgeon, and I want to tell you something directly before we go any further. An elevated PSA number is not a diagnosis. What that number means, and critically, what it does not mean, is far more complex than most men are ever told, and in some cases, more complex than some doctors take the time to explain in a 10-minute appointment. Now, before you say, I know, the PSA test is unreliable, my doctor already told me not to worry about it, let me stop you right there. Because there is a significant difference between being told not to worry and actually understanding why. And that understanding is what changes how you advocate for your own health from this point forward. So I'm not here to dismiss this test. I'm here to explain it properly, the way it should have been explained in that exam room. Today I'm going to walk you through what this test was actually designed to measure and why. That matters. What an elevated number genuinely means clinically. What the many non-cancer causes of PSA elevation are that far too few men are told about. And what the path forward looks like when a result comes back concerning. This is the conversation you deserve to have when you got that call. Let's have it now. Let's start at the foundation. PSA stands for prostate-specific antigen, a protein produced almost exclusively by the prostate gland. A small amount of it naturally enters the bloodstream, and that's what we're measuring when we run a PSA test. Here's the critical thing most men don't know. PSA was never designed to be a perfect cancer detector. It was designed to measure a protein. And that protein rises for a whole host of reasons that have absolutely nothing to do with cancer. The test became one of the most widely used cancer screening tools in medicine, and that was never wrong. But it has been widely misunderstood, overpromised, and in many cases, used in ways that led to a great deal of unnecessary fear and, in some cases, unnecessary treatment. That misuse is not a reason to dismiss the test. It is a reason to understand it, with the nuance it actually deserves. So let's talk about what this number is actually telling you, and what it isn't. When most men get a PSA result, they're handed a number, say 4.5 or 6.8, and told whether it's normal or elevated, and that can feel very black and white. But the science is anything but. Traditionally, a PSA level below 4 nanograms per milliliter has been used as the cutoff for what's considered normal. But here's what that doesn't account for. PSA levels naturally rise with age. A PSA of 3 in a 45-year-old looks very different from a PSA of 3 in a 75-year-old. In fact, most urologists today don't look at a single PSA number in isolation. We look at age-adjusted ranges, trends over time, the rate at which the number is rising, and a number of other clinical factors. A PSA that jumps from 2 to 4 in a single year might concern me more than a stable PSA of 5 that hasn't budged in 3 years. We call the rate of change PSA velocity, and it gives us far more information than a snapshot number ever could. Then there's PSA density, which takes into account the size of your prostate. A larger prostate, something very common with benign conditions, will naturally produce more PSA. So we divide the PSA level by the volume of the prostate as measured on ultrasound, and that gives us a density figure that's often much more meaningful than the raw number alone. And here's something that might genuinely surprise you. You can have prostate cancer with a completely normal PSA, and you can have a very elevated PSA with no cancer whatsoever. Both of those scenarios happen more often than people realize. This is the part I want every man to understand, because this is where so much unnecessary anxiety begins. There are many conditions and circumstances that can raise your PSA level that have nothing to do with cancer, and if your doctor isn't walking you through these possibilities, you're not getting the full picture. The most common one is BPH. Benign prostatic hyperplasia, or an enlarged prostate. This is an incredibly common condition, especially as men age. By the time a man is in his 60s, the majority of men have some degree of prostate enlargement, and a larger prostate simply produces more PSA. That's not cancer, that's physiology. Prostatitis, inflammation or infection of the prostate, is another significant cause of PSA elevation. Whether it's acute bacterial prostatitis or the more chronic, low-grade variety, inflammation can cause PSA levels to spike dramatically and temporarily. I've seen patients come in with PSA levels in the teens or even higher, only to find out they had an undiagnosed prostate infection. Treat the infection, retest, and suddenly the number looks completely different. Recent ejaculation can temporarily raise PSA levels. Most guidelines recommend abstaining from ejaculation for 24 to 48 hours before a PSA test. But many men aren't told this, and many labs don't ask. Vigorous physical activity, particularly anything involving pressure on the perineum, like cycling, can transiently elevate PSA. Even a digital rectal exam performed right before drawing blood for PSA can influence the result. Certain medications, on the other hand, can artificially lower PSA, which raises its own set of concerns. Men taking 5-alpha reductase inhibitors, a class of drugs used for hair loss or prostate enlargement, typically have their PSA cut in half. If your physician isn't accounting for that, they may be looking at a falsely reassuring number. All of this is to say, a PSA result is a starting point for a conversation, not an ending point. It's a clue, not a verdict. Here's one of the most difficult and nuanced conversations in urology, and one that doesn't happen often enough in the exam room. Prostate cancer is not one single disease. It exists on a spectrum, from extremely slow-growing tumors that may never cause any meaningful harm during a man's natural lifespan, all the way to aggressive, fast-moving cancers that require urgent treatment. One of the biggest challenges with PSA screening is that it can detect cancers that would never have caused a problem. We call this overdiagnosis, and the treatment that follows is called overtreatment. And the treatments for prostate cancer, while often effective, are not without significant consequences. We're talking about potential incontinence, erectile dysfunction, bowel complications, real, life-altering side effects. This was at the heart of a landmark study published by the U.S. Preventive Services Task Force, which at one point actually recommended against routine PSA screening for all men. A recommendation that was later revised, but which sparked an important debate that continues today. The pendulum has swung back. Guidelines now generally support shared decision-making, meaning the physician and the patient sit down together and weigh the benefits and the risks based on that individual person's health, age, family history, and preferences. A 55-year-old man with a strong family history of aggressive prostate cancer is in a very different conversation than a 78-year-old man with multiple other health conditions. One size does not fit all here, and if you've never had that individualized conversation with your doctor, it might be time to ask for it. So your PSA is elevated. What should actually happen next? The first and most important step is not panic. I say that not to minimize your concern is completely valid, but because decisions made in a state of fear are rarely the best decisions. Take a breath, ask questions, take your time. The next step is typically a repeat PSA. A single elevated number rarely tells us the full story. We want to see whether the number holds, rises further, or perhaps comes down, which it sometimes does, particularly if there was an underlying infection or inflammation causing the elevation. Your urologist will likely also perform a digital rectal exam, or DRE, to physically assess the prostate, its size, texture, and whether there are any areas of concern. From there, newer and more sophisticated tools have dramatically changed how we evaluate elevated PSA. We now have what's called the PSA free-to-total ratio, which looks at what proportion of your PSA is free versus bound to other proteins in the blood. Men with prostate cancer tend to have a lower percentage of free PSA. This ratio can help us better distinguish who truly needs further investigation. There are also newer biomarker tests, things like the 4K score, the Prostate Health Index, and SelectMDx, that provide a more nuanced risk assessment and can help guide whether a biopsy is genuinely warranted. And when it comes to imaging, the MRI-guided approach has been revolutionary. A multiparametric MRI of the prostate can help identify areas of suspicion before a biopsy is even performed, making the entire process far more targeted and meaningful. I want to spend a moment on a concept that has genuinely changed lives, and that many patients never hear about until they're already anxious and overwhelmed. For men diagnosed with low-risk, early-stage prostate cancer, active surveillance is often not just an option. It is a completely valid, evidence-backed, guideline-supported recommendation. Active surveillance means we monitor closely. We repeat PSA tests at regular intervals. We may perform periodic biopsies. We use imaging. And we watch the cancer for signs of change. We don't treat unless something tells us we need to. This approach has allowed thousands of men to live full, healthy lives with prostate cancer without ever experiencing the side effects of treatment, because for many men with low-risk disease, treatment would have caused more harm than the cancer itself. This is not neglect. It is not giving up. It is precision medicine, matching the intensity of the intervention to the actual risk of the disease. And for men who qualify, it can be enormously liberating. If you've been diagnosed with prostate cancer and active surveillance hasn't been discussed, please ask. Ask your urologist whether you're a candidate. Ask what your Gleason score is, what your clinical stage is, and what your individual risk profile looks like. You deserve that conversation. There are real, evidence-based steps you can take to support your prostate health, and they're probably not as complicated as you might think. Diet matters. There's growing evidence that a diet rich in vegetables, particularly cruciferous vegetables like broccoli and cauliflower, may offer some protective benefit for prostate health. Tomatoes, particularly cooked tomatoes, contain lycopene, an antioxidant that has been studied in relation to prostate cancer risk. Reducing red processed meat intake and prioritizing plant-forward eating is something most urologists would agree supports not just prostate health, but overall health. Exercise is one of the most powerful tools in your health arsenal. Regular aerobic activity improves circulation, supports healthy hormone levels, reduces inflammation, and has been associated in multiple studies with reduced risk of aggressive prostate cancer. Maintaining a healthy weight matters. Obesity has been linked to more aggressive forms of prostate cancer and to worse outcomes. This isn't about aesthetics. It's about the biology of inflammation and hormone regulation that excess body fat can disrupt. And stress, the silent adversary of so many health concerns, matters here too. Chronic stress affects your immune function, your hormone levels, your sleep. Managing it is not a luxury, it's a clinical necessity. None of these things guarantee you'll never face a prostate issue, but they give your body the best possible foundation, and that is always worth something. I want to end with this, because I think it might be the most important thing I've said in this entire video. The relationship between a man and his urologist should be a genuine partnership, not a transaction, not a conveyor belt where you come in, get a number, and leave more confused than when you arrived. You should feel comfortable asking your doctor, what does this number mean for me specifically? What are all the possible reasons it could be elevated? What are our next steps? And why those steps in that order? What are the risks of acting and the risks of waiting? What would you do if this were your PSA result? Those are not difficult questions. They are not unreasonable questions. They are exactly the right questions, and a urologist worth their title will welcome every single one of them. If you've been handed a PSA result and sent on your way without a real conversation, please know, you are entitled to more. You are entitled to understanding. And if your current provider isn't offering that, it is completely within your rights to seek care from someone who will. Your prostate health is one piece of a larger picture of who you are and how your body is doing. Don't let a single number, without context, without nuance, without dialogue, define your peace of mind. Knowledge is not fear. Knowledge is power, and you now have a great deal more of it than you did when we started. Brief pause, warm, direct look at camera. If this video was helpful, and I genuinely hope it was, please hit the like button below. It's a small thing on your end, but it makes a real difference in helping other men find this information when they need it most. And if you're not subscribed yet, I'd love to have you here. I put out new videos every week on exactly these kinds of topics. The clinical conversations that don't always happen in a 10-minute appointment. If you want to go deeper, I've covered testosterone, prostate health, and pelvic floor function in other videos on this channel. I'll put the most relevant one right here for you. Take care of yourself, because you are absolutely worth it.